Compulsory jabs are also being debated in the UK, where the country's vaccination minister says the government's considering making shots obligatory for NHS frontline staff.
There is precedent for this. Obviously, surgeons get vaccinated for hepatitis B, so it's something that we are absolutely thinking about.
My colleague Ewan O'Neill debated the issue with supporters of the move and also with critics too, who reject the comparison with the hepatitis jab.
It was a ridiculous comment for him to make because the difference with those jabs is they've been properly tied and tested. The COVID-19 vaccines have yet to be fully licensed. That won't happen until 2023. So at the moment, where the population who are having the vaccines are effectively being guinea pigs. Unfortunately, the UK government has coerced people in the care and health profession to have this vaccine against their wishes, and of course with the general public as well. And because they have exercise the control on the UK media, we haven't been able to have a proper debate.
That is a political decision and one that they will have to take, and has been one that's been coming down the tracks for them ever since the vaccines were released. But it's not a surprise at all, and I suspect, just my suspicion, that they'll end up making it mandatory for all staff.
If you're telling people they have to have something that a year ago they did not have to have at all, that's a very rapid change, isn't it, in somebody's health?
It is, but that's a decision for politicians to make. We have this.
Is it really though?
Of COVID, what is a problem? What are we doubting? Are we doubting the amount of transmission that happened in hospitals about, less than 6 months ago? It was enormous.
I definitely do not think that's going to be welcomed by a large majority of staff. It feels a little bit intrusive, and considering the disproportionate number of healthcare workers that were affected by COVID, it would be very difficult to understand why we would be wanting to have mandatory vaccinations. I think the disturbing aspect of this is that lots of us lost our lives and were affected by COVID-19 due to lack of PPE. There was poor communication. We felt the brunt of it. Most of us are working on stress and PTSD, and now all of a sudden the government, if they're supporting, now injecting us with this same vaccination, they need to address the issues, the wider issues, the safety of this vaccine. You can't just expect us, a lot of people will actually flee the health service if it becomes mandatory.